Good afternoon and welcome to today's webinar, Caregiving and Technology, Latest Devices and Applications. My name is Juliana Valencia and I am a Social Services Specialist with Fairfax Area Agency on Aging. Today's presentation is being recorded and you will get a recording early next week. Also, you will get the slides for today's presentation at the end of the webinar. And just so you know, this presentation is going to be interactive, so we encourage you to submit your questions using the Q&A box. Something very important for us, and we will appreciate if you could take a few minutes at the end of today's presentation and just help us by filling out our survey, because it really helps us informing our webinars and preparing and planning for our next sessions. Now, it is my pleasure to introduce today's speaker, Steve Gurney, who is the founder and publisher of Positive Aging Sourcebook, which he started in 1990, drawing from the experience of observing his family caring for his grandfather. He created a comprehensive publication to help others in the same situation. For over 25 years, Steve has built a community of senior serving professionals designed to help make connections, share resources, and improve support and services for older adults and their loved ones. He has produced hundreds of live events that have attracted thousands of providers. Now, in 2020, these meetings transitioned to live and interactive online digital discussions, offering up-to-date content on a weekly basis and featuring international renowned thought leaders in the field of aging. Steve served on the board of directors for the grassroots organization for the well-being of seniors, as well as the Alzheimer's Association, Interages Business and Aging Task Force, Virginia Intergenerational Task Force, and the Beacon Institute. Steve has served on the faculty of the Johns Hopkins University Odyssey program and served as an instructor at several universities and corporate training programs. Steve is a regular speaker at local, regional, and national events and has been featured in regional and national publications, electronic, and broadcast media. He received a bachelor's degree in business administration from Old Dominion University and a master's degree from the Erickson School of Aging Studies at the University of Maryland, Baltimore County, where he also served as an adjunct professor instructing in the undergraduate and graduate programs. Steve, welcome, and thank you for being here with us today. Please take it away.
Wow, thanks a lot, Juliana. And let me see if I can share my screen here. Okay, and just Juliana, if you can just confirm that you're seeing on the screen helping you stretch for a new perspective.
Yes, I can see it.
Okay, great. Okay, folks, I'm real excited to chat with you about technology in the field of senior living and some different tools that you can use. I'm hoping we can make this interactive, and so I'm going to check in periodically to make sure that we that if you've got any questions, I'd love to make this interactive throughout versus me talking and then responding to your questions. So let me get started here. And before we talk about this apps and technology and things that I've got to share with you, I love opening all my presentations with some images to really get us thinking about what it really means to grow old and what how as we move through the chapters of our lives, how we don't change all that much, but just to kind of get you thinking about this. And so I love this series of photographs here, okay? And if you can't see them that well on your screen, they're images of older adults looking in the mirror at their younger self. And one of the things that I've done over the years is I'm adjunct professor at the University of Maryland, Baltimore County, where I teach undergrads, 18 to 21-year-olds, classes about aging. And they always respond so positively to these images because oftentimes there's this stigma that sometimes we put it on ourselves that, oh, geez, I've got gray hair now, I'm getting older, I can't get around, or what have you. And you know, when you really think about it, when I think about it, who I am and what I feel and the emotions at 55 are not that much different than when I was 25 or 30 or 15 for that matter. And so a reminder that I love sharing those images. I'm kind of babbling here. The other two images that I love to share are these. This is an ad campaign that was in the UK, and the first one says "wrinkled wonderful and gray gorgeous." And when I used to speak live at senior centers on a variety of topics, I would share these images with the audience, and I would say, look at these two women, you know, wrinkled wonderful. She could get some plastic surgery to get rid of those wrinkles to be more beautiful, and this woman could dye her hair a million different colors as opposed to leaving it gray. So these two ladies, are they beautiful? And the audience would always erupt and say, yes, they're beautiful. I was like, really? Because you know, the major media and advertising would have you think differently, wouldn't they? You know, that wrinkles and gray hair are something you want to get rid of. And I'd say, well, what makes them beautiful? And inevitably, I would hear smile and a twinkle in their eyes. And I promise I'm going to get into technology, and this relates, is that as we move through life, that we're presented with a lot of challenges. It could be loss, it could be mobility issues, it could be healthcare issues. And keeping that beautiful smile on our face can oftentimes be difficult. And I, in talking to so many of our readers over the years, have found that, you know, in general, a smile equals purpose, having a purpose in life and being able to engage and do the things that you love or do new things. And now this relates to the technology that I'm going to share with you today. Is that the technology that I'm sharing with you today, while it might be targeted to an older audience in some ways, is really designed to, the things that I'm going to share are designed to help people live a more purposeful life and consequently have this beautiful look that we all aspire to. And I tell people, you can borrow this when you go to a barbecue and you hear somebody complaining about their crow's feet and how they look old. It's sort of like the secret to looking young, and there's no way to look young, okay? But the secret, if there is to have a smile on your face. You know, all the plastic surgery and hair coloring doesn't do a darn bit if you got this scowl on your face or you got a frown. So, okay, let's dive into some technology. And I'm going to start with what I actually feel is probably the most important and useful technology for older adults and families that's out there these days, and that is voice technology. Okay, so if you're not familiar with voice technology, this is the Google Home, the Amazon Alexa. There's a few other products that are out there, but the leader in this space is Amazon Alexa, and they've done a great job. Now, one of the reasons that I like voice technology is that this is not a device that was created for older adults. This is a device that was created for everybody, and it can help older adults, it can help busy moms, it can help young children. And the first time I discovered the power of voice technology for older adults was chatting with a friend of mine who was, he and his brothers and sisters were concerned about mom because mom was living alone. They felt like mom would be best if she moved to a senior living community, and mom flat out refused. Does this sound familiar to somebody that you know? I know lots of people. I talk to them every day that are in this same boat. And they tried to do about everything they could to make her home safer, including going out and purchasing one of the iPhone and I Can't Get Up devices, which she flat out refused to wear. And so then my friend got the great idea of installing an Amazon Alexa in every room in her house. So I might add, the real catalyst to this is that mom was developing severe macular degeneration. It was progressing at a level that really made them concerned about her well-being there in the home. And so she was reduced vision, refusing to leave the home, and she's an adult, that's her right, and figuring out how can we make this place safer. And so he installed an Amazon Alexa in every room of the house. He created these laminated sort of tutorial cards on how mom could use this, and expected her to be resistant, but actually had the exact opposite, because Alexa was something that her son had in her house and she had seen it and thought it was cool. And so now mom wakes up in the morning, Alexa, how's the weather today? Alexa, turn on WTOP. I want to hear the news. Alexa, read that she I believe was could have the New York Times read to her on Alexa. But the other thing that she could do is that now she could make phone calls. The coolest thing that he shared with me is that they used to have a weekly shopping trip that one of the kids would come over and get mom's shopping list, go to the store and bring it back and do her shopping. Now mom just adds all the items that she wants on her grocery list. She says, Alexa, pull up grocery list, add bread. And then instead of the kids going shopping, she goes, Alexa, buy grocery list. And it goes to the Amazon grocery delivery, which now comes to her house. And apparently their drivers will come in and put the things away for mom. So this really opened my eyes up to just a really cool technology that wasn't designed for older adults that could be very helpful. Now, Amazon, as we know, very innovative company, they've created a free platform on Amazon Alexa called the Care Hub. And you can sort of see in this image here that I've got what the Care Hub does. It enables you to have a group of people that are communicating with a loved one, let's say it's a parent, via the Care Hub app. And so there's a dashboard. Mom is only revealing the things that she's comfortable with, but you could sort of monitor sort of the activity as an adult child, as well as it makes it easier to sort of prompt each other because you're on sort of this Care Hub app. Now, I talked about the iPhone and I Can't Get Up devices. There are actually on Alexa, they don't call them apps, they call them skills. So there is this iPhone and I Can't Get Up device where if you fell in your house and you could verbally say, I think it's called My Buddy. It's like, my buddy, contact my son, and now emergency is notified, just like if you were pressing a emergency call button. Okay, so that's voice technology. I've got lots of other stuff that I'm going to be sharing with you, and the other thing that I want to share with you is that you'll notice on the right-hand side of your screen there, you see this Assistive Technology Showcase, and it's this Friday at noon. The things that I'm going to be sharing with you today, I have had detailed 1 hour live and interactive conversations with the entrepreneurs and the pioneers that are offering all the things that we're going to be talking about. So everything that I'm going to share with you today has an hour discussion that you can listen to, and you can hear the questions that the audience members were asking about that specific product. So at the end of the discussion, I'm going to give you a link where you can see all those. And also, Juliana is going to share this PowerPoint with you where you can see, like at the bottom of the screen, I've got varelay.org. I'm going to talk about Virginia Relay. You can go right to their website. So hopefully today's discussion is an introduction to a bunch of technology that might be helpful, and then you can dive into the ones that seem more interesting to you. So assistive technology is, I want you to think of that as devices, products that can help you, and oftentimes assistive technology can be associated with hard of hearing and low vision. And but what I have on the screen here are some really cool options for people that are hard of hearing. Okay, so Google has a cell phone that is actually absolutely amazing for people that are hard of hearing. It has a captioning feature on it that is just absolutely amazing. So the Pixel 4 cell phone is, so if you had somebody who is hard of hearing, they could just open this phone and put it in front of you, and while you're talking to them, it's creating a very accurate large print version transcript of that conversation. So think about that. Like now, somebody hard of hearing going to a restaurant, you know, all they got to do is just open up their phone and they can hear the waiter talking about the special of the day, and they can read along with it. The Clarity phone provides real-time speech-to-text translation and support for people with hearing loss. The iPad has tons of speech and language apps that are out there that can be installed on there to make life a lot better. And the Touch Talk is a phone that is often recommended by speech and language pathologists for people that suffer aphasia. So like a weak voice, oftentimes triggering anything voice activated can be rather challenging. Now, here's the good news. All of these products that you see on the screen, you may qualify, or your loved one may qualify to get these for free or at an extremely low cost, thanks to the Virginia Relay program. So you see down at the bottom, varelay.org. Hearing loss is not necessarily a doctor's diagnosis. If you have difficulty hearing on a phone or hearing while you're watching TV or something like that, that probably qualifies for the Relay program's reimbursement, and for you to get various technology to make your life better. All of us who pay our phone bill pay into this Relay program in every state to give people with a hearing deficit the opportunity to get free technology and support in the event that they need it. This Friday, I hope you tune in to our discussion where we're going to talk about amplified and caption phones, the Pocket Talker personal amplifier. This is an amazing device. It looks like the old school Walkman with a little microphone on it. So it's super affordable. You might get it for free with the Relay program, but it enables more of a directional amplification. So whether you have hearing aids or not, this can be of helpful. We're going to talk about TV listening devices, which if you've got somebody that you live with that can't hear the TV, instead of cranking it up to 100 and disrupting the whole house, now they've got their own personal TV listening device, and signaling devices for doorbells and phones. So somebody who might be hard of hearing, they don't hear the doorbell ringing, but there's signaling devices where a light can go off so that they know that somebody's ringing the doorbell. So we're going to dive into that, and I've got recordings that I'm going to share with you if you want to dive into some of those previous recordings. Okay, let's see. I am just checking in. Looks like we're at 19 after. I don't see any questions in chat, so I'm going to keep on rolling here. But
we have We have a question that was sent privately. I don't know if you will address this later, but the question was, how about technologies for visually impaired people?
Yeah, so going back to the assistive technology slide, I apologize. I have not had a discussion on visual impairment yet, but it's something that I'm working on. So definitely join our mailing list, and I'm going to make that a priority, especially after this discussion. But what I would say in terms of assistive technology for blind and low vision, one of the cool things is the speech to the voice technology with Alexa, like that's probably some of the easiest technology for a low vision person, as I had described with the macular degeneration. My friend whose mom had macular degeneration. One of the other things that can be really helpful, like I'm legally blind in my right eye, so when I close my eye, I can, I'm legally blind. Now I can see things, but it's extremely blurry and it's not clear. However, on the iPad and the iPhone, the ability to increase the size of type is so easy and so seamless that oftentimes I've found when I've talked to low vision people. The other thing is speech to text technology is amazing for people of low vision, where you used to not be able to type an email out, whereas now you can recite an email out with the speech technology that's used on our phones. It can recite it back to you. You can edit it over voice as well. So I hope that was helpful. I must admit that I haven't had a specific low vision discussion recently, and I'm going to put that on my priority list thanks to this question. But voice technology is the way to go with somebody with vision issues. Okay, the next slide of resources that I've got for you are some applications and education and engagement. So one, and I'm just going to kind of go around this I'll go counterclockwise here. So the first thing that I want to share with you, forgive the pun, is the concept of home sharing. Home sharing is becoming much more popular with older adults, because if you want to age in place and not move to a community, oftentimes living alone can be lonely and isolating. And home sharing for older adults not only creates companionship, it saves money, and it also may, if your roommate is willing, bring an additional group of resources to you. For example, the first time I heard of an older two friends sort of doing the Golden Girls thing and sharing their home, it was because one of the women loved to cook, but didn't drive, and the other woman drove but didn't like to cook, and they decided, one sold her house, they moved in together, and they had this unbelievable collaborative sharing relationship. Now, you might not have a best friend or a sister who you're ready to move in with, and that's where this website, Silvernest, can come into play, because this website helps match older adults up with other people that might share their home with them. So Silvernest is a great one to keep in your back pocket or share with your friends. Okay, the best thing that ever happened to transportation in this country and the world is Uber and Lyft. Let's face it, who likes to see a taxi cab pull up in front of their house? I'd rather have a regular car pull up in front of my house. And the fact is, I can't rate an individual taxi cab, whereas I can rate an Uber driver, and that way, that Uber driver is way more motivated to create a great experience for me than a taxi cab driver. What's the problem with Uber and Lyft? They require very skilled usage of a smartphone, and you can't call them. No matter what, you can't call them. So welcome to GoGo Grandparent. So you see this website and the phone number on my page. GoGo Grandparent, you can call that phone number. You don't even need a smartphone, and they will book an Uber or Lyft ride for you with a driver that is senior friendly and eager to work with older adults and trained in some cases to work with older adults. So GoGo Grandparents, you know, you might think of it as low tech because you can now just dial a phone and get a ride just like you would for a taxi. But why this is on my slide deck here is what they've done is they've taken this high-tech thing, shared rides, that's only done on a smartphone, and used that technology to make it applicable to a phone call. And I'm eager to see what they come up with next, because they've really bridged this divide and seen this weak spot to technology where you can't interact with a live person. Okay, the next category of resources I want to share. Yep, Juliana? Oh, did you have a question? Oh, okay, all right. The next category of resources I want to share with you are, I just put them under the umbrella of classes. And I love both of these resources. Get Set Up and Senior Planet, okay? They're both very similar. They have put together amazing online communities for classes, connections, exercise, learning, you name it. It is, both of them are amazing. They have different approaches. Now, Get Set Up, where I refer people to Get Set Up, is Get Set Up is a great way to literally overnight become an expert in technology. They teach small classes. Primarily, a lot of them are on how to use Facebook, how to use your iPhone, how to use Zoom. And these are taught by older adults to older adults, and they have created this amazing system on how to make sure everybody in the class walks away with a great learning experience, okay? So Get Set Up has a lot of classes, but man, they are great for technology, and a lot of their technology classes are free of charge. They have some classes where they clearly have, you know, college professors teaching those. They might have a nominal cost to it, but fantastic resource, Get Set Up. Senior Planet started out sort of being a live, sort of like a Senior Planet. There's a Senior Planet Center in Montgomery County, Maryland. But when the pandemic hit, they quickly transitioned to online. And you can see one of the recordings that we did with this woman that was totally isolated at home all by herself in the middle of COVID. And she just moved to Montgomery County, Maryland. She didn't have any friends. She discovered Senior Planet, and she said that she has friends now from all over the nation. In fact, when she was on our discussion, she was like, all my friends at my yoga class are going to wonder where I was today, and I'm going to tell them about you guys that I was talking with you. Okay, let me keep on going here because the hour is ticking by. Down below, you see engagement. This is an amazing platform that was called Big and Mini, that was started by a college student in the middle of the pandemic. And he was isolated, and he started to reflect on he and his classmates in college that were isolated, and how could they impact how could they make connections. And so he created Big and Mini. So the minis are the college students, and the bigs are the older adults. What a great way to frame that generational divide in a positive way. And so Big and Mini, so it's sort of almost like pen pals over Zoom, where they connect a big and a mini who share their thoughts and resources. And we, again, on the online discussion that you can look up, you'll see this wonderful relationship that was developed out of a college kid and an older adult, and how powerful that was. And that's a free of charge service as well. Now this one is fun. I have it under the heading of downsizing, fairsplit.com. Okay, now I don't know if there's anybody in the audience that has baubles or fine china that you're just, you know, okay, I'm keeping these items because I'm going to pass them along to my daughter, and she's going to treasure this collection just as much as I do. And oftentimes people are struck with the reality that their kids don't want all the stuff that they've got, okay? So what Fair Split does, it organizes these things in it's got a ton of features on it, but the thing that I love the most is an individual can add in, or somebody can do it for you. This could be a project for your adult child, you know, is that you add your items into Fair Split. And then you can actually, it has a feature where your family members can vote on how emotionally attached they are to these items, okay? And what this does, let's say that you got 5 kids and 6 grandkids, and you've got all these items, and you don't know who wants what or if they want anything, okay? Wouldn't it be great to get all that stuff documented? Then it's sort of like voting. You can sort of vote on the things that you would really find value in as a family member. So now it takes all the mystery out of it. It's like, wow, my daughter doesn't want my china. So guess what? We can sell that or give it to somebody that wants it. Or, you know, maybe there's somebody in the family that is really emotionally attached to that. So Fair Split is just, it's a great tool, and it's a great thing to utilize now, because we've all probably sort of seen how people can argue over estates after we're gone. And I'm sure none of us want that to happen. And Fair Split is a technology solution that can help minimize that from happening. All right, so my next slide I'm going to move into is I titled Brain Fitness and Health. And just a reminder, I know I'm just giving you a glimpse at different apps and technologies. Any of these things I'm talking about today, we've got an hour discussion with and many times the founder of these companies talking about this in much more detail, giving you demos and a bunch of great audience questions that came in as well. So
Hey,
let's talk. Yep.
We have a question, and I think it's related to the prior slide, and it talks about privacy issues. It says privacy issues are a common concern for technology devices. Do you feel this is a legitimate concern for family caregivers when buying technology?
Yes, and you know, I was kind of waiting for that question when we were talking about Amazon Alexa, because it always comes up. It's the, oh, my son-in-law said the government's listening in on Amazon Alexa, so I shouldn't have one of those devices. Okay, here's, you know, does technology aggregate data? Absolutely. Okay. Technology platforms are trying to make it much more transparent when they're collecting data and aggregating it and giving us all options to sort of opt out of certain data collection elements, okay? But is it something, and everybody has a different level of comfort on this element of privacy, okay? My rule of thumb in general here is, okay, for these devices here, so for example, my example of my friend whose mom is going blind, and it's sort of like the value of voice technology in her home, to sort of say, oh, we aren't going to put this in here because mom might be saying some things that could be aggregated in the cloud there, and we don't want her to compromise her privacy. the benefit of mom having that information, in my mind, far outweighs any risk of sharing information. That where so most of the data that is collected on apps and devices is used in the aggregate. It's sort of saying, okay, we have 100,000 users that are 85 years and older, and they use these apps. So let's make it easier for them to use these apps. If you're on social media, what you'll see is aggregate data in that you're putting postings up about the fact that you collect Beanie Babies, and all of a sudden you're getting ads for Beanie Babies. In my mind, that's a lot better than getting ads for Viagra or something that is not relevant to you at all. And so that's how our data is being used in aggregate. Now, I don't want to discount privacy and disclosure when using technology for organizations or individuals that might somehow commit fraud against our elders or use data in a harmful way. And we all have to be extremely cautious in those areas. But in those areas, you want to be more cautious in terms of when you get a phone call and somebody says, let's look at the screen right now. Like, let's say that you get a phone call from somebody and they say, hi, Mrs. Smith, I know that you're a subscriber of Dacom Fitness. We need to get a new credit card from you. And it's sort of like, you know, that's not Dacom Fitness. That could be some hacker that's out there that found out that you have a subscription to Dacom Fitness and they're exploiting you. Amazon is notorious for this because everybody shops on Amazon. So you have to be very careful when you click on a link that you think is Amazon, it might be one of these hackers out there. And so from a privacy perspective, we all have to be extremely cautious and extremely aware of the con men and women that are out there leveraging the good players and exploiting us. I kind of went off on that a little bit long, but I hope I answered your question there. It's a balance. With all of these things, there are positives, and you want to sign up for platforms where the positives of these platforms on the screen outweighs any negatives that could occur due to you sharing data or communicating with them. The things that I have on the screen right now, Dacom Fitness and Brain HQ by Posit Science. These are brain training apps. Really cool. In fact, Brain HQ, there's another one called Luminosity that's out there. And these are games and processes and things of that nature that have been, for the most part, clinically proven to improve our retention, our memory, and things of that nature. To give you an idea that I think is great, Brain HQ is used by Tom Brady, the Super Bowl winning quarterback, because when he gets the ball, he has to make snap decisions, you know, and he trains his brain the same way he trains his body in a gym. And that's what brain training is all about. And the exciting thing is we're living longer. The downside to us living longer is the longer we live, the more of a chance that we're going to have cognitive decline, dementia associated. And if we can train our brains to create that cognitive reserve, it may be helpful in our healthy longevity. This other company here that you see, Gait Better, this is a really cool device that can work with any treadmill to help improve an older adult's gait and balance. And it's not necessarily a consumer product, but if you go to gaitbetter.com, you can see some rehab facilities that are using this technology to help older adults with their balance, gait, and strength. Okay, the next slide. This is some fun stuff here, guys. Artificial intelligence, monitoring, and virtual reality. And let me just check. And then I think I have one more slide and then we'll wrap up. Okay, So the first product here that is Meadows IO. This is an artificial intelligence, and because it's in the beta testing phase, it's absolutely free to everyone. So if you go to Meadows IO, and what this does is using artificial intelligence, it makes a phone call to an older adult or a loved one every day, and it prompts that person through a series of questions. And through that series of questions and utilizing artificial intelligence, they are able to help determine well-being, communication, and how that person is doing. It's in the testing phase, but artificial intelligence has been proven, is making leaps and bounds, and this is one that is directing itself into the older adults market. The founder's mom is an aging life care manager, and he developed this product based on the conversations that his mom was having with her clients every day. The next one below is Viva Vita, and this is a company that's committed to utilizing virtual reality. So have you ever seen those headsets that people wear, where you can use a virtual reality headset to experience travel and classes and a wide variety of other elements. Viva Vita works closely with senior living communities. So many senior living communities are now adding this virtual reality headset as a new experience for their residents that are there. And it has come in very handy during the pandemic and during isolation, because you can be transported to the streets of Paris, and you can be on a guided tour all around Paris, and it feels just like you're walking down the street. Aura Ring, I don't have an Aura Ring. This is my wedding band, but Aura Ring is, so there are 3 items here that I would sort of call predictive technology. So the Aura Ring is a very non-invasive product. You're just wearing a ring, and it is taking a variety of metrics from your body to predict if you may be getting sick, coming down with COVID, you name it. And it actually, they've had so many users, and this is academic test case, that they can predict based on the changes in your body when you are getting the flu before you get the flu, because they've had so many users using this. Really cool technology, and we did a great discussion on that. Care Predict is another product that I'm super impressed with that was very helpful in COVID. So Care Predict, again, is monitoring our body metrics to predict if a health event is coming up. But Care Predict, to give you an idea of how cool this is, some senior living communities are getting Care Predict for all of their residents and all of their staff. So let's assume that a staff member got sick and didn't come into work. With the Care Predict, with everybody wearing the Care Predict watch in the community, they can immediately know what residents and staff that staff member that's sick came in contact with, and isolate them or monitor them because they may be coming down with the same thing. And this was very helpful in COVID, but I see this being very helpful in the future for flu, sick, cold, you name it, you know. The Kanega watch is this watch that's on the lower right-hand corner, and this is more of like the iPhone and a can't get up device, but in a much more beautiful, attractive shell. And it has GPS technology, so that if you were at the grocery store parking lot and you fell, that somebody would be notified. And then Stack Care at the top, This is a monitoring device that can easily be installed in anybody's home. And this goes back to the privacy issue, is that you may not want this in your home. But for somebody who, let's say, is living with a spouse or has a parent that may be wandering or have some health issues, Stack Care, through a series of monitors that are placed around a home, can begin to monitor the behaviors of the person that is at home, so that, for example, if mom doesn't get out of bed in the morning, that, I can give her a call and find out why, so. Okay. Yeah, this is my last slide, and I'm going to talk about some platforms for caregiving and communication. So most people by now have heard of the GrandPad. This is an iPad specifically designed for older adults, and it's been around for quite some time. So the amount of thought and research that has gone in to the GrandPad is absolutely mind-blowing. Right down to the box that it arrives in if you order one of these things. They have figured out how to deliver this to somebody that might not be very technically savvy. They can open this box and get started on the GrandPad. And it's very intuitive, a lot easier than an iPhone or an iPad. As you can see at the image that I've got on the screen, large buttons and icons and things of that nature. So very impressive. And this is a great tool for activities, for engagement, to make calls and things of that nature. Over on the right-hand side of the screen, you see a product called Independa. And what Independa does, it can turn any television set into a communication device. So what you see on the screen there is an actual TV set, and you see how mom is in the corner. She's having a phone call, Zoom call, with her kid and grandkid. And so oftentimes, navigating this for FaceTime or a laptop computer can be challenging. Independa uses our TV set, something that we're using in most households every day, and turn that into a communication and entertainment device. Then below Independa there, you see Raz Mobility. This is a phone that was created for people with dementia and cognitive impairment. So you see how there's like one big picture on that phone. They have basically simplified and stripped down the phone to the bare minimum, so that somebody with mild dementia wants to call his son, he just presses that image on the phone, and he can do that. So very simple, very easy to use, but it's been shown very positive consumer adoption for people who have loved ones with dementia. Next to the left of that is Lots of Helping Hands. Lots of Helping Hands is a really cool website. So let's pretend that you have a loved one that is moving to an assisted living community. One of the things that I oftentimes recommend is we've got to rally that person's family and whole network to support the assisted living in that care and become part of that community. And so the base of Lots of Helping Hands is this calendar. And so, for example, let's say I went to go visit mom, and I had a conversation with mom, and it occurred to me that mom needs new socks. So now I could go on Lots of Helping Hands, which has our whole family and extended network, and I could type in, hey, I was just over at mom's, she's doing well, she's got a new best friend, and for the next person that visits her, if you could go to Target and get some nice white socks for her. So you can see how using a platform like that can really improve the care and communication amongst a drawn-out network that might be more difficult by using a phone tree. And then the last one that I've got on here is a company called INF Care. This is a local company that was actually created on the campus of George Mason University through an incubator. And their first product was Rudy the robot. It was a robot that would actually be in somebody's home or a senior living community that had a variety of functions to provide companionship, activity, and communication. Well, when the pandemic hit, they basically separated their technology from the robot product and created INF Care, which is, could be somewhat comparable to GrandPad, except for it can be used as an extension for a loved one that may be at home receiving care. An INF Care can be a great way for caregivers, families, and older adults to communicate with each other. Okay, looks like I'm at 12:50. I burned through an awful lot there. When you get this PowerPoint, you're going to see two links. And the first link, let me see what happens if I click on it. The first link here is going to lead you to all of our digital discussions. So this, on the left-hand side of the page, you can see all of our previous recordings. So for example, yesterday we had a discussion on the value of music for older adults, and you can listen to that. But then on the right side, you can see what we've got coming up. So remember on Friday, I said we've got this assistive technology showcase. Tomorrow, if you're not doing anything at noon, Homes That Make Life Easier to Support Aging in Place, the Universal Design Living Laboratory. This woman, Rosemary, is an internationally renowned speaker on this topic. She was in an accident and she created an amazing universal design home. So that's where you can get that. But then if you look at the second link here, when you click on that, what you're going to get, these are the recordings to all of the things that I just talked to you about. See, the clinically proven brain fitness program, artificial intelligence for caregivers, all that stuff is there. So I hope this was helpful. And Juliana, if we've got any additional questions, I'm happy to do my best to answer them.
Yes, thank you so much. That was very, very interesting. There were a lot of new things that I've learned about, especially the grandpa pad, or I think that was, yes, GrandPad. There you go. I had no idea that was available. And I think that might be related to a question that came from someone in the audience. It says, looking for apps or websites for simple puzzles and games to keep their brains active. Everything I have come across requires tech savvy that my parents don't have. Do you have any suggestions or anything that can help these caregivers?
Yeah, GrandPad has puzzles and games on it, and it is more user-friendly. I totally get what you're saying, is that, for a lot of these products, it requires somebody to log onto a computer by themselves and, just get through those opening screens and remember the passcode and all that stuff. The things that a lot of us take for granted in terms of ease of use can be awfully complicated to somebody that is never, that is not a tech savvy individual. And I am encouraged, by the real life testimonials that I've heard from people that have bought GrandPad for their parents. So that might be something to check out. And I agree, Juliana. I think that that might be a good direction to go in.
So we have another question, and this is kind of a two-type of question. This is a kind of, and especially now with the pandemic, a lot of us have been kind of taken out of our comfort zone by technology because we had to learn very quickly a lot of new applications and things like that. So what are some of the barriers you have seen or heard about that caregivers are facing to access technology, and what suggestions do you have to overcome some of those barriers?
So there's one of these things. So I'm babbling here a little bit, but but there's one challenge that we face is sometimes is who is the person introducing the technology to the older adult. A lot of times it's their children, okay? And the way that we might be communicating with mom and dad can be disparaging without us even knowing it, you know. And we've all heard this term, becoming a parent to your parent, in this space. Nobody wants their kid to become their parent. Nobody wants to be spoken to as though with baby talk, or you know, that they're not as skilled as they can be. So one suggestion in introducing technology to an older adult is finding somebody that could potentially do that, that might not have those sort of skeletons in the closet. It might be that friendly high school kid that's right across the street, you know, who's going to college for technology, who is looking for some volunteer hours, or just, you know, really enjoys talking to your mom. I highly recommend Get Set Up. And one of the things that you might do, even if you are an old a caregiver or an adult child, is say, hey mom, I found out about this website, Get Set Up. I went and checked it out, and they've got a class on how to use Facebook. You were asking me how to use Facebook, and you know, we kind of got in an argument on that. How about both of us tune in and let's go to the Get Set Up class on how to use Facebook. And now it's an outside third party that is sort of teaching this as opposed to somebody else. Mm-hmm. I do feel that what we think is easy, navigating an iPhone, can be extremely difficult for other folks. And in addition, if there are vision and hearing, that could be challenging. If there's vision and hearing, you know, organizations like Virginia Relay for the Hearing, looking up the local low vision center, these places have tons of resources that are out there.
Thank you. And I also want to remind people in the audience that we do have a volunteer program, IT support, that we are able to pair people with volunteers who can help people in the community learn to navigate Zoom, or how to create a Facebook page. So if you have a question about that volunteer program, please let me know. You can email me. So we still have 3 minutes. So I want to remind everyone in the audience, if you have any questions, please go ahead and submit it. Also, I just want to let you know that as you signed out, there will be a brief survey. Please take a few minutes to fill it out. It really helps us get your feedback and to hear what you thought of today's session. So Steve, one last question. Have you come across any research showing how technology has impacted, you know, family caregivers, older adults during this pandemic? Because I know, I mean, we have talked a lot about isolation pre-pandemic and during the pandemic, and then post-pandemic, but how has technology also helped with it?
You know what? I'm so glad you asked that question, because that's what I was going to open up with today. But then I got caught up in my, you know, slides that I always like to share. Now, I don't have actual documented research, but I can say anecdotally that the pandemic was horrible for a lot of things. But the pandemic was actually absolutely wonderful for the senior living provider network in getting us from being this slow to no tech adopter to literally overnight utilizing technology in every aspect of our industry. And I like sharing this story, and this is a good way to close, is that I got a friend whose mom is in a nursing home. And before the pandemic, she would go see her mom, you know, once or twice a week, okay, and give her a hug and sit there and chat face to face once or twice a week. Pandemic happens, mom's isolated in the nursing home. Every single time I would talk to her, she's just, you know, I'm so upset. I can't believe this. I can't see my mom. I can't hug my mom. and I'd console her and everything like that. But she had purchased a nice, beautiful iPad for her mom. The staff at the nursing home trained and worked with her mom on how to do FaceTime calls and all that type of stuff. My friend communicates with her mom 5 times a day now on this iPad in the middle of the pandemic, okay? And it's hard. I had to point out to her that, look, I know your heart is broken, but you were only seeing your mom once a week, okay? And you even told me that driving an hour to the nursing home, sometimes you'd only stay there for 15 minutes because you had to drive an hour back to take your kid to soccer. Now you're having these great conversations 5 times a day, and mom can call you, you can call mom. The beauty of what's happened here with technology is this is not going away. Almost every senior living community that I know of has technology easily accessible to all the residents that move in. So if today your mom's moving into an assisted living or nursing home, it's 100 times better than it was before the pandemic because of technology. You're going to be much better connected. So that's anecdotal, but I've heard enough of these stories to know that this is forever changing the face of senior living.
I agree with that. We are at 1 o'clock, so if you all have a few more minutes, we have one more question.
Okay.
So the next question says, what's the latest technology for dealing with wandering?
Oh, okay. So I don't have it on the screen, but I will. You can contact me directly, and I can help you with some of this. There's some interesting. Well, so for example, like the Kanega watch that I showed you, like that's a good example because there's a GPS tracker in it that could assist somebody with wandering. But I think one of the best products, and I don't have it off the top of my head, it's actually an insole that goes into a shoe that is a tracker, okay? And that's a fantastic product because chances are most people are not going to go out wandering outside without their shoes on. I mean, it can happen, okay, but they're not going to get as far with their shoes off. But the tracker that's in the insole of the shoes is a great product that for if you're caring for somebody at home that's wandering, that's a great potential solution.
Yes, and also I want to remind everyone in our audience that there is the Project Lifesaver program through the Sheriff's Office, which you can reach out to the Sheriff's Office and ask about it. And this is for people who tend to wander, not only for older adults, but also for children. And this program has a 100% success rate in locating the missing person. They will be able to tell you more about how it works, but basically it's through a bracelet. It is not a tracking system, but when the person is reported missing, and if they are in this program, the Sheriff's Office will activate an alarm, and then they will come out with an antenna, and then they will be able to locate the missing person. So I want to thank you, Steve, and for giving us your time. This has been very, very insightful, very informative, and I would love to continue to speak with you, but I know everyone has other things that they probably have planned for. I just want to invite everyone as well to our next webinar next month, and it'll be driving safety among older adults, a medical perspective. It will be on Wednesday, July 21st at noon. And with that, I want to say thank you and have a wonderful afternoon, everyone.
Thank you.
Bye.